That's a huge question. I mean, we could discuss this for hours. Could you be more specific in your question somehow? Could you limit it?
I think part of it is a question of data, right? People always want to know, how can we reduce bias? That's one thing. And I think one of the other things is about ensuring that our systems don't do harm to the patient. So should AI developers almost be interested in the Hippocratic Oath to the same extent that a doctor is?
Well, the first question was about bias, and this is something discussed everywhere right now. I mean, it's been to the newspapers. We all know those examples of bias because the data set was biased. And this is certainly something the developers of AI algorithms are responsible for. When you collect the data sets you need for the training of your algorithms, you have to make sure that the population is similar to the population where you want to apply your AI algorithm. Otherwise, you will have a bias. And automatically, you probably will have a bias if you take, let's say, an algorithm who was trained in Africa somewhere, and you try to apply it in Sweden. It's not the same population, and you will have a biased algorithm. And the second part of your question about
Hippocratic Oath.
responsibility of the developers, it's not that easy. I mean, you cannot simply transfer the responsibility to the developers. It's very similar to an MR or CT. Certainly the manufacturers of diagnostic machines and of algorithms should do their best to adhere to ethical principles. But at the end, the medical doctor who is talking to the patient, who is in contact with the patient, and in whom the patient places his trust, he's the one who is responsible, and he has to take the responsibility when he's using AI algorithms. So I don't think that the developers should comply to the Hippocratic Oath. That's not the point. This part is really to the regulators.